Hey everyone, good morning. And many of you have asked us, how do you get into competitive specialties like OBGYN? So today we have Dr. Flores, who teaches many of our students. They go for rotations with him. So we want to pick his brains on what is a day in a life of a OBGYN resident? What do these programs look for when they evaluate IMG application in terms of the skills and experience? What can you actually get from these rotations? How does it teach? So eventually you can make it to that residency program. So it's my pleasure to welcome Dr. Flores, who's affiliated with Mercy Hospital, has prior experiences at Rush University, Mount Sinai. So he brings in extensive experience. Welcome, Dr. Flores.
Welcome. Thank you for having me.
And also, it's my
Well,
pleasure to welcome Dr. Ms. Toya Banks, who guides many of our students for the rotation. So, welcome, Ms. Banks, as well.
Good morning. Thank you for having me.
Thank you, thank you. Sorry, Dr. Flores. Let me get
well,
back to you. I think you were saying something. So, welcome, and
sure.
do you want to introduce yourself?
Yeah, Dr. Ramon Flores. I went originally to University of Illinois for medical school. Then after that, I did internal medicine for 2.5 years, OBGYN, then following. And I was interested in OBGYN because my wife and I lost a baby, and I figured that I was going to be better than everybody else. Well, obviously, I don't think so, but I definitely try to be my best every time. And then after that, I trained in residency, OBGYN, board certified in 1991, member of the University of Chicago and Rush, and Michael Reese Hospital, one of the saddest situations where they closed that hospital. It was a world-renowned hospital all over the world about 30 years ago. Um, so I paid some of my dues, I guess. And the first thing that I would tell the students who want to go into BGYN is, are you willing to work without sleep
Ah,
and to perform efficiently 100% without sleep? And the doctors who trained me told me that you have to do a cesarean in your sleep and you got to do it right.
yep.
You got to deliver your baby in your sleep and you still got to do it right. So it takes a little more than just brains, which um, thanks to the Lord, we all have enough brains to do what we need to do in whatever career we choose. But it takes a little more intensity and effort to be an OBGYN. And I usually can read that from my students when I talk to them. I usually ask them, why do you want to be a doctor? They go ahead and they explain that to me. And then that way I know in which direction I'm going to go with them,
Mm-hmm. Okay.
especially if they're interested in OBGYN.
Okay. So,
I guess that's a brief touch.
yep. So let's pick it up from there. What is a typical day in the life of a resident? Especially for our IMG applicants, they can get a sense of how the system works in the US.
Well, the first year is probably just a regular intern. You have to go through the motions of learning how to associate all your uh, anatomy, pharmacology, physiology, pathophysiology training in medical school to go ahead and put it into action when you're an intern. And I always say it, and I'm very blunt and occasionally somewhat candid when I say the first thing you learn to do as an internship is not to kill anybody. Make sure that you don't hurt anybody. Make sure that you ask questions. You're always sure of yourself before you give a medication. Don't feel embarrassed to ask questions or whatever. And then after that, after you know, uh, pass your first year of medical school of residency, then you go and you embark into the specialties of OBGYN, sometimes covering the emergency room. You're on call every other night. When it was for me, right now is 12-hour shifts for them. Personally, I think they're having it kind of easy because sometimes we did 36, 40 hours straight.
Wow.
And no mistakes because our older doctors did not allow that. If you come in here and you think you're going to make a mistake and we're going to pat you in the back, no, we're going to whip you in your behind. And so I think that's actually a good way. Now, I don't treat the residents that way now, but I give them the point and I give them experiences that I had where I'm tired. I didn't have all the information on one patient doing morning rounds, and we had 27 patients to discuss. And one of the doctors gave me a so-so evaluation. I went to ask him why. He almost kicked me out of the office through my behind. So I learned from that. You got to do your best every time and take it.
Right.
But it's not like that now. They have actually modified it. Now they have 12-hour shifts. But I think what that does is it makes you mentally strong to perform at 100% efficiency, whether you're tired, whether you slept, whether you ate or not, whether you had a fight with your wife, or you're worried about falling in love with a girlfriend. Same thing.
Okay. So obviously a lot of hard work, sleepless nights and ability to perform at a highest level are some of the things. What are some other skills, experiences, the uniqueness of this specialty that makes it different from other specialties? What else?
Well, we're not only taking care of the one patient, we're taking care of two patients, or if it is twins, three patients, or triplets,
Right.
or whatever, how many situations like that, we're taking care of more than one patient. Everybody expects this to be 100%. You have a baby, you're pregnant, you have a baby, and nobody thinks anything, just like I did think when my wife and I lost my baby. The reason why I made a vow to be the best I could be in this profession. So sometimes when my students ask me why do I do it, I tell them, and I say, well, that's how I decided. Now you can do it both for surgery, you can do it for heart, you can do it for anything else. But you have to have some sort of a calling or some sort of a.
Mm-hmm.
I'm a little more emotional than most people, I guess, but that's how I felt about my career, and I passed that on to the students.
Okay. So now let's move on and talk about the application, the IRAD application interview. So what do programs look for, especially when it comes to the IMG community? What are they looking for when an IMG applies for OBGYN residency?
Well, when I was at Mount Sinai and when I was at the University of, when I was at Michael Reese, actually, we had University of Illinois rotate through Michael Reese. And we had, in our Mercy, of course, a residency program. And the program's directors pay attention to the score, the
Mm-hmm.
scores, the exam scores. I recall not many occasions, but several occasions where I came out and the chief of the department told me, wow, look at the score on this guy. I said, yeah, but he doesn't have the attitude for it.
I see.
He didn't, he felt that he could get away with passing a high score. And unfortunately, sometimes they do. And then the mistakes happen after they're out practicing, and then they don't take the intense and careful evaluation of patients to make sure that you don't make mistakes and you treat them right. And
Dr.
so,
Flores, do you think that that's one of the biggest misconceptions with IMGs is that they think they just need a good score? They don't put into factor everything, the
I think
whole
so.
around
I think so.
person.
Yeah,
Yes.
I do. And I bring up to them that I wasn't originally born in this country. I was born in Cuba. I came here as an early age, and I had to do a lot of grades that I had already done in my country here all over again. So I learned how to persevere, and that perseverance is what I pass on to them. But I also think that the program directors should understand that you're working with a second language, not your language. It may not be your native language.
Yep.
And the study methods in your country are different than in this country.
Okay.
And so you have to overcome all those changes in the culture. Now you have to assimilate it, and eventually you will assimilate it. I have a little accent depending whether I'm upset or a little bit nervous sometimes. But I wanted, when I came to this country, to blend in and not to speak English incorrectly or with a lot of accent.
Mm-hmm.
That was my intention, because I wanted to really show that I am here, I belong here. So that's what I pass on to the students.
Okay. So now let's talk about your rotation and training. Uh, how exactly do you do it when it comes to the 4 week or 6 weeks training? How the IMGs that come to you, how are they prepared for the application, interview, and eventually residency? So, can you talk a bit about your rotations?
Well, my rotations, when they come in, I assign them a book.
Okay.
I give them a reading schedule that they are supposed to be do reading on their own. And some of the older doctors taught me, we're not spoon feeding doctors. If you want to be a doctor, you have to do your own reading. So I go ahead and I give them that. And I expect, and occasionally when they say, well, um, Dr. Flores, am I going to get a good grade or whatever? I say, well, I will know when I ask a couple of questions if you're reading. And so I give them specific topic. And on occasion, I come in that day and it's a complete surprise. I said, okay, what is this part of labor? And I give them a specific term. And then they say, I said, then you haven't been reading that chapter. And so I get them back into formality. Not like school students. Obviously, everybody's different. If I have doctors from um, other countries or other states talking to me, obviously they're professionals already. They already been through that part. But for the medical students, I'm a little more forthright. But I am not nasty at all. Not mean to them at all. I said, no, I'm going to tell you before I get you in trouble and with your grades. I'm going to talk to you. And I'm going to see if you are going to make some changes so that I can give you an above average score. That's how I do it.
Okay. And
Because I think that we actually injured the record of one of our students, maybe because he had a bad day,
mhm.
maybe because I understand that that can happen.
Yep.
So I put a little bit more of my feelings into that, but I commit to them. I commit to them, and I realize who's got the direction and who doesn't, and then I guide them that way. That's the way I was taught.
Okay. So specifically, you mentioned that a lot of IMGs who come to you may already have training in their home country, right? They're already
And they're
practicing.
highly qualified. They're highly qualified, but maybe the grades, because it's a second language, second culture scores, exams are not as good as the general pattern of the program directors accept. However, I feel that you can overcome that with your personality.
Hmm.
And I think I tell them I improve of that.
Okay. So specifically with these students, is your focus more on didactics or counseling, or how do you specifically
No,
deal with
no,
the IMG community?
no, no. They have to pass the exams. They got to do the best they can at the exams. I, if they say, "Oh, I have to study for this exam," I understand. I understand. But you pass the exams. You know the guidelines. You know the recommendations. You know the protocols. But remember, the patient doesn't follow protocols. You have to do something better.
Yep.
Statistics are statistics. If it happens to be like one of the doctors told me, if it happens to be 1% for you, it's 100% for you. If you're the 1%, it's 100% for you.
And let's kind of build off of on that. For an IMG to get into OBGYN is harder than say internal medicine or some of those. Is it you find, is it because the systems have been different, in their home country versus US? Is it language? Is it a combination of all? What is it?
I think it's a combination, but I think even though, I mean, when they said to me, I didn't do so well in this exam, I remember when I was taught when I was in medical school, one of the doctors says, what do you call a person who graduates from medical school with the lowest score in the exam? Think about it. I said, you call him doctor. He's still a doctor. He got through. Now you can overcome the rest of your deficiencies later on, and hopefully you will with your intensity, your emotions, and your will to be better than average. I also had another mentor who told me, he says, you don't want to be average. Average is the same distance from the top as it is from the bottom. So I passed that on to him.
All right. Well,
So I think, go ahead. So
no,
I think that if you feel that some students who rotate with me, they might be able to do better or they might be able to get through, it's because I tell them to overcome whatever it is with their efforts.
right. Okay. Ms. Toya, anything else you'd like to add? You have seen a lot of our students, right? So what can they do to
Yes.
improve?
Number one, and I actually said I was going to write a blog and post it, confidence.
Hmm.
Confidence. You are not, IMGs are not second class medical students. Your confidence shows. Am I right, Dr. Flores? I have so many IMGs. If they can have the confidence that they need, they will get an interview. They will get a residency, but they lack so much confidence. So that's part of our program that Dr. Flores is talking about. We install and try to instill in them, you're a doctor still, no matter where you went to school, you graduated, you're a doctor. Now, show us. Know it. You are that doctor.
How bad
know it. How bad do you want it? And so personalities, your rapport, all of that. People think it's just your scores. It's not just your scores. I've been doing this a very long time. I've sent it on many interviews. It's not just your scores. It's you. You have to sell yourself. Am I right, Dr. Flores? You have to sell yourself.
I know.
And all of that. Yeah. So it's just, if there's another option that we can add to our program, I think it should be a motivational section where we instill in them the confidence that they need. Right, Dr. Floyd? That's how I feel. And I'm like, you guys are awesome.
Yeah,
so many are so talented, but they don't know it.
But I think what happens many, I'm sorry I'm interrupting you, but
No.
I think what happens is they lose their confidence when they talk to other students and they couldn't make it. And it reminds me, and I go back, Mr. Kira, I go back to when I was in college, repeating all my years again, doing high school in this country again, and going, and in college, and I heard all the people in the cafeteria. He didn't pass physics. He didn't do well in organic chemistry. He didn't do that. And I said, I'm going to have to stop listening to these people because
exactly.
I'm going to stop going to the cafeteria and study. And that was my change because then I found a way myself. And so the students, the foreign graduates, come in with that stigma over their heads.
Yes.
We got to take them out.
They listen to their
Take them
seniors.
out, that's take them out.
My seniors, yes, exactly.
So,
My seniors told me this. My seniors told me that.
and
You
they
know,
get
if your
depressed.
seniors, yeah. So you have to know this for yourself. They are so
They get
caught on what my
depressed. They also
senior
get
says
depressed,
this.
and I understand.
Yeah. But they have to think for themselves,
Yeah.
and they have to just have the confidence. And unless your senior is on a program committee or residency committee, your senior don't even know how they matched. That's the thing that they need to know. And that's what I come up against. Well, my senior says this. My senior says that. If your senior don't even know how they matched because they wasn't in on the interview. Yeah. You know, I was in an interview with a program director last week, interviewing someone, and when the person get off the phone, they were saying, well, they were on a virtual, and they said only thing they said they were so nice, it was so easy, and they saw my pictures of my children on the wall, and people didn't tell me that interviews are like this. We think they're going to ask us about cases and patients. No. That do not happen. They want to know about you. So bring the full plate to the table.
Occasionally they do. Occasionally.
Yeah,
occasionally they do.
But it's you.
When I was applying for residency, when I was applying for residency, in one of the interviews, they asked me medical questions. Mm-hmm. They asked me about preeclampsia. They asked me about diabetes in pregnancy. I said, how am I going to answer this? I said, okay, I did the best I could. And then he says, you have any question for me? And I said, yeah, did I pass the question?
Exactly.
Give him a jump, you know?
Yes.
Or they ask you, do you do terminations, elective abortions or anything? Mm-hmm. And I said, well, I know, because I dedicated myself to delivering healthy babies. But in this hospital, in the interview, they had the ability to do that. And I said, however, you know, after I get into a residency here, I might have a better answer for you in 4 years, sir. Mm-hmm. I given the jab sort of like giving me a chance at getting back at you. But not that I'm scared of you, and that you have to develop. You develop that over the time, and I think all the students can do that.
Well, thank you very much. This was very informative. I hope a lot of students get the motivation and confidence from this talk. So I appreciate your time, Dr. Flores, on a Sunday. Thank you very much, and much appreciate.
I tell them to all buy me the lottery ticket. All of them to buy me a lottery ticket if I win the lottery. Okay. Bad joke. Anyway, no, I looking forward to more students, and looking forward. I love what I do and my career, of course, my profession, and I love teaching. I love teaching because I mold them. I rather teach students than actually residents, because the residents sometimes they have all the answers, and those are the guys you have to be scared of. But no, I think that looking forward to that. So thank you very much for having me, and whenever you like, you're welcome to contact me, and we'll have a talk. If you come to Chicago, we'll go for Cuban sandwiches.
Absolutely. Absolutely. Will do. Thank you. And you have a very nice weekend. Right. And thank you.
Thank you. Thank you, Dr. Flores.
Okay.
You're cool.
Bye.
Right,
bye.
Bye-bye.
Bye.